Hospice care is end of life care of the patient who is, basically exhausted all diagnostic and possibilities and treatment, and the patient is at the stage that he wants to enjoy their own normal life as much as possible, without pain, without discomfort, but also transitioning to dying. And of course, the most common knowledge is hospice is end-stage dying from cancer, but it's not necessarily just that. There's a lot of heart diseases that can cause dying, and Alzheimer's disease, and they're actually a little bit harder because patients and families don't know when exactly that's going to happen, but there are some telltale signs to know that patient is more immobile and less like eating less and maybe less engaged in conversations. There are ways to know when the patient is closer to dying and transitioning to it. Hospice care is taking care of the patient by definition, it's the last 6 months of life or less, to provide care for the patient so he doesn't feel pain, discomfort, shortness of breath. Also from patients and patients' families, they don't have to be in a hospital or be intubated, like doing CPR unnecessarily, where there's really not going to regain a lot of quality of life back. They're at home, they're at peace, they're not in pain and discomfort, they have access to the nursing care and doctors and medications, and they don't restrict themselves from pain medications too. So unless they're in hospice care, they will not get a lot of pain medications in general. Normal hospice services are physician access, physicians visiting the patient with each certification on when patient requests. We have a registered nurse also evaluating the patient and seeing them at least on a monthly basis or more often if needed. And LVN seeing patient every single week. If patient is very sick, then she can see the patient like twice a week. The same with CHHA. It's certified home health aid that provides light housekeeping, cleaning the patient, helping feeding the patient. They can come like once or twice a week as needed. Frequently they do like giving shower to the patient or bed bath if patient is bedridden, trimming the nails, things that sometimes we don't think about, but it's part of life, trim the nails, make sure that the teeth are brushed at least once in a while. They can do it themselves. And trying to make them clean shaved and nice looking too.
As a society, as a consumer, if you will, we don't really understand what hospice is because it means someone's dying, and that's a negative. But ultimately, we do have to embrace it. So the question becomes, what's the best way to do that? So from a caregiving family standpoint, the family can talk to the doctor. A doctor can recommend that hospice is appropriate, and we can provide services that give dignity and peace of mind to the family. There are, patients that discharge from the hospital that social workers will recommend to the family that hospice is appropriate, and patients and families always have a choice with whom they want to work. A patient can go on hospice, and oftentimes we see that they get better because they're getting the attention they need at home. And they see the relief with the family. The family's they get a break. And so they can get better. And they can go off hospice. and they can also go back on. Hospice is covered by Medicare, and oftentimes families suffer from financial situations and they can't afford even the pads or diapers for the loved one. And those are basic needs. So when the patient goes on hospice, that's an example of a supply that is covered. And at Doctors Preferred Hospice, we provide all the equipment and the supplies that are needed. My personal experience with hospice involves my mom, and my mom passed in January of this year. And so I became uniquely qualified to help other families because I experienced it on my own. And there's nothing like that experience. And when you have the attention that you need from the medical team and from the bereavement team, it makes the death transition so much more pleasant, if you will. Because the death of a loved one is frightening. Because we're not medical physicians, and the physician, people can't be there 24/7 to say whether or not the patient is actually dying. And our knee-jerk reaction is to call 911 and get them back in the hospital. But that's not what's always best. And especially under hospice, we need to help the family understand that the patient wants to stay at home, that's their wish, and we respect that. Typically, in a hospice visit, a nurse will visit with the family and find out all of the information that we need, including consent and their wishes for being resuscitated. These are all questions that aren't always pleasant, but they need to be discussed so that we know the wishes and then we can execute them.